Welcome to our presentation on dental implants for heart failure patients. Today, we'll cover whether implants are safe, how they affect heart-related scans, and how to decide what's right for you. First, please note our disclaimer: this information is for education only, not medical advice. Heart failure and implants involve risks that vary by person, so always consult your cardiologist and dentist before deciding. Let's get started with what dental implants are and why they matter for you. Dental implants are a great way to replace missing teeth. They're fixed into your jaw, acting like natural tooth roots, and can last 10 to 20 years, helping you chew and smile confidently. But if you have heart failure, the surgery needed for implants raises important questions about safety. We'll explore those next, focusing on how your heart health affects whether implants are a good choice for you. If your heart failure is mild and stable, for example, you can do daily tasks with little fatigue or shortness of breath, implants can often be safe with your cardiologist's approval. Studies show a 90 to 95% success rate in well-managed cases. However, risks like bleeding from blood thinners or slower healing due to heart failure need careful planning. If you have severe symptoms, like frequent swelling, your doctor may suggest waiting. Your healthcare team will ensure the procedure is tailored to your heart health. Implant surgery carries a small risk of infection, but antibiotics are only needed for specific cases, like if you have a prosthetic heart valve, per American Heart Association guidelines. Medications, like blood thinners, may increase bleeding, so your dentist and cardiologist will work together to manage this. Diuretics for heart failure can also cause dry mouth, which affects oral health. Coordination between your doctors is key to keeping you safe. If you need imaging for your heart, here's what to know. Dental implants are safe for MRI scans and don't affect heart-specific scans like echocardiograms or chest CTs. They may cause minor distortions in head or neck scans, but radiologists can usually work around this. For example, special software can clear up images in 98% of cases. This means your heart scans should stay reliable. As a heart failure patient, you may need scans to check for stroke or heart attack risks, especially in your coronary or carotid arteries. Dental implants won't affect chest scans, but they could blur head or neck scans, which are important for stroke risk. Radiologists can use tools like artifact reduction or alternative tests, like ultrasound, to ensure clear results. Talk to your radiologist if you need frequent neck scans. Let's compare your options. Implants feel natural and last a long time, but they require surgery, which may be risky if your heart failure worsens. Dentures are non-surgical and cheaper but may slip and need replacing every 5 to 8 years. Bridges are fixed and avoid surgery but last less long and can affect nearby teeth. This table helps you see which option fits your health and lifestyle. Your dentist can guide you to the best choice. Deciding on implants? Here's a simple guide. First, ask your cardiologist if your heart is stable. Tests like an echocardiogram can confirm this. Then, talk to your dentist about your medications and infection risks. If you have severe symptoms, consider waiting. If you're older, non-surgical options like dentures may be safer. Check with your radiologist about scan impacts. Finally, compare costs. Implants are pricier, around $3,000 to $5,000 per tooth. Your doctors will help you weigh these factors. You might be wondering, will implants hurt? With local anesthesia, you'll feel little pain, and any soreness afterward is manageable. Recovery takes 1 to 2 weeks, though it may be slower with heart failure. Implants won't affect your heart medications, but blood thinners may need adjustment. They won't interfere with heart scans but may slightly affect head or neck scans. If your heart failure worsens, future implant repairs could be riskier, so plan ahead with your dentist. To wrap up, dental implants can be safe for stable heart failure patients with proper planning, offering a 90 to 95% success rate. They don't affect heart scans, though head/neck scans may need adjustments. For elderly or severe heart failure patients, dentures or bridges are often safer. Talk to your cardiologist and dentist to create a plan tailored to you. If you have questions, your healthcare team is here to help.